Welcome to this important discussion on a topic that is both sensitive and often misunderstood. Today, we're going to talk about a phenomenon that many men over the age of 50 experience, yet few openly discuss: ejaculation without semen, sometimes referred to as dry orgasm or retrograde ejaculation. In this video, we'll dive into what this condition really means, its medical, emotional, and relational significance, and how to approach it with understanding and confidence. This subject is often surrounded by confusion and stigma, and our goal is to shed light on it in a way that promotes clarity and open conversation. I want to express my sincere gratitude to you for being here today and for your willingness to engage with a topic that is sometimes challenging to talk about. By watching this video, you're showing a commitment to understanding a deeper aspect of human health and sexuality, and that openness is truly valuable. So, thank you for your curiosity and for joining us in breaking down the taboos that can make these important discussions difficult. Whether you or your partner have experienced this, or if you're just curious to learn more, I hope this video provides valuable insights and practical advice that can help you navigate this part of life with greater understanding. As men age, it's natural for various changes to occur in the body, and sexual health is no exception. One such change that many men over the age of 50 may experience is ejaculation without semen. While this might seem alarming or confusing at first, it's important to understand that, in most cases, it is not something to worry about. This condition, often referred to as dry orgasm or retrograde ejaculation, occurs when semen is not expelled during orgasm. Instead, it may flow backward into the bladder. While the sensation of orgasm remains intact, the absence of semen can be concerning for both the individual and their partner. However, it's vital to approach this topic with a balanced and informed perspective. Why is it so important to understand this? First, knowing the cause of this change can help reduce unnecessary anxiety. It's common for individuals to feel confused or even worried when they experience something unfamiliar, especially when it relates to sexual health. However, once you understand that this is a relatively normal part of aging or a possible side effect of certain conditions, you can address it with less stress and more confidence. Furthermore, this topic is not just medically relevant, it's also crucial for emotional and relational well-being. For men experiencing this, it may bring up feelings of frustration or embarrassment. For their partners, it could lead to confusion or concerns about intimacy and fertility. That's why understanding the underlying causes, having open conversations, and being aware of possible solutions is essential for maintaining a healthy relationship and sexual connection. By the end of this video, you'll have a clearer understanding of what's happening, why it happens, and how to approach it in a way that promotes both personal and relational well-being. So, let's dive deeper into this topic and explore the causes and implications of ejaculation without semen. Now that we understand why it's important to address ejaculation without semen, let's explore the various causes behind this phenomenon. While it can be a natural part of aging, it can also be triggered by other factors like medication, surgery, hormonal changes, or psychological influences. Let's take a closer look at each of these causes. 1. Retrograde ejaculation. One of the most common causes of ejaculation without semen is retrograde ejaculation. In this condition, instead of semen being expelled through the urethra, it flows backward into the bladder. This happens because of changes in the muscles surrounding the bladder neck and urethra, which can lose tone or coordination as we age. These muscles are responsible for directing the semen outward during orgasm, but when they weaken, the semen may end up in the bladder instead. While retrograde ejaculation may sound alarming, it is typically harmless. The semen that enters the bladder is naturally expelled when you urinate, so there's no lasting health concern. However, for couples trying to conceive, retrograde ejaculation can be a challenge, as the semen is not expelled in a way that allows for fertilization. In such cases, medical consultation is recommended to explore possible solutions. 2. Medication side effects. Certain medications can interfere with the normal ejaculatory process, leading to the absence of semen during orgasm. Medications commonly prescribed for conditions like hypertension, diabetes, or prostate issues are often culprits. For example, alpha blockers, used for prostate enlargement, and antidepressants can alter the nerve signals and muscle functions involved in ejaculation. If you are on medication and notice changes in your sexual health, including ejaculation without semen, it's important to consult with your healthcare provider. They may be able to adjust your medication or offer alternatives to mitigate these side effects, ensuring both your physical health and sexual well-being. 3. Prostate surgery. Prostate surgeries, particularly those used to treat benign prostatic hyperplasia, BPH, or prostate cancer, can affect the structures responsible for ejaculation. During these procedures, certain parts of the prostate and surrounding tissue are removed or altered, which can disrupt the normal path for semen expulsion. As a result, retrograde ejaculation becomes a common side effect. While these surgeries can significantly improve urinary symptoms and overall quality of life, it's essential to be aware of the potential impact on sexual function. Discussing the potential for retrograde ejaculation with your doctor before surgery can help you better understand and manage these changes afterward. 4. Hormonal changes. As men age, testosterone levels naturally decline. Testosterone plays a crucial role in sexual function, including sperm production and ejaculation. While reduced testosterone levels rarely cause ejaculation without semen directly, they can exacerbate other factors that contribute to this condition. For example, low testosterone may weaken the muscles involved in ejaculation or impact the nerve signals that control the process. If you suspect that hormonal changes are playing a role in your sexual health, it may be worth consulting an endocrinologist. They can help assess your hormone levels and, if necessary, recommend treatments such as hormone replacement therapy to help restore balance and improve sexual function. 5. Psychological factors. Finally, it's essential to recognize the role of psychological factors in sexual health. Anxiety, stress, or self-consciousness about bodily changes can negatively affect sexual performance, including the ability to ejaculate normally. Emotional well-being plays a significant role in overall sexual health, and mental blocks can sometimes interfere with the physical processes of arousal and orgasm. If anxiety or stress is affecting your sexual experiences, it's important to address these concerns openly with your partner and, if needed, seek support from a therapist specializing in sexual health. Addressing the psychological aspect of sexual function can alleviate the emotional burden and help restore a more fulfilling intimate connection. Understanding the various causes of ejaculation without semen is an essential step in addressing this issue. Whether the cause is physiological, hormonal, medication-related, or psychological, knowing what's behind the change can help you approach it with greater clarity and confidence. In the next section, we'll dive into the emotional and relational implications of these changes and explore how to maintain a healthy and fulfilling connection despite them. Ejaculation without semen can have significant emotional and relational implications, both for the individual experiencing it and for their partner. While this condition is often physically harmless, it can bring up feelings of frustration, confusion, or even distress. Understanding and addressing the emotional aspects of these changes is just as important as understanding the physical causes. Shifting focus in later life sexuality. As men age, their sexual health and intimacy often evolve. For many, the focus may shift away from physical performance, such as the ability to ejaculate, to a deeper appreciation for emotional intimacy and connection. Sexuality in later life is not solely defined by orgasm or the act of ejaculation, it is about sharing moments of closeness, affection, and mutual understanding. This shift in focus can be liberating for both partners, as it allows for a richer, more meaningful connection that doesn't solely depend on physical outcomes. Understanding that sexual intimacy is more than just the mechanics of orgasm can help alleviate any pressure or dissatisfaction stemming from changes in sexual function. Maintaining emotional intimacy. While physical changes in sexual health are inevitable with age, the emotional connection between partners becomes even more important. Maintaining emotional intimacy, through meaningful conversations, affectionate gestures, and shared experiences, can strengthen relationships and help couples adapt to these changes. As the physical aspects of sexuality evolve, it's crucial to nurture the emotional aspects. This might mean holding hands more often, expressing love verbally, or taking the time to simply enjoy each other's company. When ejaculation without semen occurs, it's important to approach the situation with understanding and compassion. For the man experiencing it, it can feel like a loss of control or a change he didn't anticipate. For the partner, there may be concerns about intimacy or fertility. Open, honest communication is key to navigating these emotions and maintaining a strong bond. Redefining fulfillment in intimacy. One of the most important takeaways from this discussion is that orgasm does not require semen for fulfillment. Many people mistakenly believe that the presence of semen is necessary for a satisfying orgasm, but the sensations and emotional satisfaction of orgasm remain intact, even without the physical release. Recognizing this fact can help ease anxiety, reduce pressure, and allow couples to approach intimacy in a more relaxed and joyful way. Sexual fulfillment, particularly in later life, is about connection, not just physical release. When couples understand that emotional closeness and shared pleasure are the true sources of intimacy, they can embrace new ways of connecting and exploring each other's desires. Reassurance for partners. For partners, it's equally important to understand that ejaculation without semen does not mean that sexual pleasure or intimacy has been compromised. The shift may take time, but it can open the door to new ways of experiencing intimacy, whether through more affectionate touch, deeper conversations, or exploring other forms of sexual pleasure that are less focused on traditional ejaculation. Supporting each other through these changes, rather than viewing them as obstacles, can strengthen the emotional bond in the relationship. It's important to recognize that intimacy is a shared journey, and both partners contribute to the experience of connection and fulfillment, regardless of changes in sexual function. Navigating the emotional and relational implications of ejaculation without semen requires open communication, mutual understanding, and an appreciation of the deeper aspects of intimacy. By focusing on emotional connection and being willing to explore new dimensions of sexual fulfillment, couples can adapt to these changes in a way that strengthens their bond and enhances their relationship. In the next section, we'll discuss some practical advice for managing these changes and maintaining a fulfilling and healthy sexual relationship. While understanding the causes and emotional implications of ejaculation without semen is essential, it's equally important to know how to manage these changes in a way that supports both your physical and emotional well-being. Here are some practical steps that can help you navigate this transition confidently and maintain a fulfilling and healthy sexual life. 1. Seek professional guidance. If you're experiencing significant changes in your sexual health, such as ejaculation without semen, the first step is to consult with a healthcare professional. A doctor can help determine the underlying cause of the issue, whether it's related to aging, medication, hormonal changes, or something else. By seeking professional guidance, you can receive tailored recommendations that are specific to your health needs. For instance, if retrograde ejaculation is the cause, your doctor may advise lifestyle changes or suggest treatments to improve your sexual function. Similarly, if medications are contributing to the issue, they may be able to adjust your prescription or recommend alternatives. In some cases, hormone replacement therapy or pelvic floor exercises could be useful options. Having a healthcare provider who understands your concerns can bring clarity and reassurance, making it easier to manage this change. 2. Lifestyle adjustments. In addition to medical intervention, making some lifestyle adjustments can significantly impact your overall well-being, including your sexual health. Regular exercise, a balanced diet, and stress management are crucial for maintaining both physical and mental health as you age. Exercise, physical activity improves circulation, boosts energy levels, and enhances mood. It can also improve muscle tone, including the muscles involved in ejaculation, which may help with sexual function. Balanced diet, eating a healthy diet rich in vitamins, minerals, and healthy fats can support hormone levels and overall vitality, promoting better sexual health. Certain foods, like those rich in zinc and omega-3 fatty acids, are especially beneficial for male reproductive health. Stress management. Chronic stress can interfere with sexual performance and emotional intimacy. Practicing relaxation techniques such as mindfulness, deep breathing, or meditation can help manage stress and improve both physical and emotional well-being. These lifestyle changes not only improve sexual health but also enhance your overall quality of life, contributing to greater satisfaction and fulfillment in all aspects of life. 3. Explore therapies. Depending on the root cause of ejaculation without semen, there are various therapies that may be beneficial. These therapies can help manage the physical and emotional aspects of this condition, improving both function and intimacy. Hormone replacement therapy, HRT. If low testosterone levels are contributing to changes in sexual function, hormone replacement therapy may be an option. An endocrinologist can assess your hormone levels and, if necessary, recommend treatments to restore balance and support sexual health. Pelvic floor exercises. These exercises, often referred to as Kegel exercises, can help strengthen the muscles involved in ejaculation. While they're commonly used for improving urinary function, they can also support sexual health by improving muscle tone and control during orgasm. Counseling. If psychological factors such as anxiety, stress, or self-consciousness are affecting your sexual health, therapy can be incredibly helpful. A therapist specializing in sexual health can help you address any mental barriers, improve communication with your partner, and explore new ways to enhance intimacy. Therapy can be a valuable tool for both individuals and couples. By exploring these therapies and making necessary adjustments, you can actively manage the changes in your sexual health and regain a sense of control. 4. Educate yourself. Understanding the reasons behind changes in your sexual health can greatly reduce anxiety and help you approach the situation with a proactive mindset. The more you learn about ejaculation without semen, its causes, implications, and solutions, the better equipped you'll be to handle it calmly and confidently. Educating yourself also empowers you to have open conversations with your partner, which is essential for maintaining a strong relationship. It also helps you take the necessary steps to address any underlying health concerns and make informed decisions about your care. 5. Open communication with your partner. Throughout this journey, open and honest communication with your partner is key. If you haven't already, take the time to talk about any changes you're experiencing in your sexual health. Discussing your feelings, concerns, and experiences together can help both of you understand the situation better and create a more supportive, non-judgmental environment. Your partner may also have concerns or questions, and addressing these together can foster a deeper emotional connection. Remember, intimacy is about more than just physical performance, it's about emotional connection, trust, and shared experiences. By communicating openly and exploring new ways to connect intimately, you can strengthen your bond and maintain a satisfying relationship. By following these practical steps, seeking professional guidance, making lifestyle adjustments, exploring therapies, educating yourself, and fostering open communication, you can navigate the changes in your sexual health with greater ease and confidence. These actions will help you continue to lead a fulfilling life, maintain strong relationships, and embrace the changes that come with aging in a positive, proactive way. In the next section, we'll explore the emotional and relational benefits of embracing these changes, and why acceptance of aging can lead to a richer, more fulfilling experience of intimacy. Aging is an inevitable part of life, and with it comes a range of changes, including shifts in sexual health. However, it's essential to remember that these changes don't have to be seen as losses or setbacks. In fact, they can be opportunities for growth, self-awareness, and deeper connection. By embracing the natural changes in your body, including ejaculation without semen, you open the door to a more fulfilling experience of intimacy. Aging doesn't diminish your ability to enjoy meaningful, loving, and passionate relationships. It simply means that the way you experience intimacy may evolve, allowing you to focus more on emotional connection and shared experiences rather than solely on physical performance. One of the most important things you can do is to cultivate a positive mindset. Approach changes in your sexual health with curiosity, acceptance, and a willingness to adapt. As you grow older, your understanding of yourself and your relationships deepens. Sexuality is no longer just about physical pleasure, it's about love, emotional intimacy, and the joy of being truly present with one another. If you and your partner are able to embrace these changes with an open heart, you can create new ways of connecting, exploring, and enjoying each other. This may involve discovering new forms of intimacy that don't necessarily rely on traditional notions of orgasm or ejaculation. Whether it's through tender touch, more meaningful conversations, or exploring different sexual experiences, these new avenues can bring a fresh sense of joy and satisfaction to your relationship. Remember, the essence of sexuality transcends physical mechanics. It is about connection, trust, and mutual respect. When you let go of any pressure to meet outdated expectations and embrace what works for you and your partner, you create space for deeper intimacy and fulfillment that grows richer over time. Thank you for joining us in this important conversation today. I hope that you've gained a clearer understanding of the phenomenon of ejaculation without semen and the various factors that can contribute to it. Remember, it's completely normal for sexual health to evolve with age, and the key to navigating these changes lies in understanding, communication, and a willingness to adapt. I encourage you to speak openly with your partner about any concerns, and to seek professional guidance if needed. By embracing these changes with curiosity and positivity, you can continue to enjoy a fulfilling, loving, and intimate relationship for years to come. If you have any questions or topics you'd like us to cover in future videos, please feel free to leave a comment below. Together, we can continue learning, growing, and navigating life's changes with confidence. Thank you for watching, and I look forward to seeing you in the next video. Take care, and remember, your journey towards a deeper connection and understanding of intimacy is just beginning.